സിനി ഡോക്ടറെ,
ഡോക്ടറെ
നമുക്ക് തുടങ്ങിയാലോ? ബാക്കിയുള്ളവർ ജോയിൻ ചെയ്തോളൂ.
ഓക്കെ ഡോക്ടർ.
ഓക്കെ, വെൽക്കം സ്പീച്ച്.
Good evening, everyone. Today our faculty is Dr. Satyanarayana B. He's done his BAMS from SDM College, Udupi, MD in Vaishajya Kalpana from IGPT, and RA, Gujarat Ayurveda University, Jamnagar. He is presently Principal, Medical Superintendent and Director of Research and Development, Munial Institute of Ayurveda Medical Sciences, Manipal. And he's been a lecturer in subjects Shastra and Vaishajya Kalpana for both UG and PG students since the last 20 years. He's PG and PhD guide, working as R&D executive, MR for ISO in Ayurvedic Pharmacy, Munial Ayurveda Research Center, and he is actively involved in design and development of Ayurvedic formulations, quality control, research based on single herbs and herbomineral preparations, and clinical research in Munial Ayurveda Hospital under Chikitsa Kalpa. He's published more than 20 research papers in national and international journals, and he's been reviewer for 3 international journals. He's presented more than 50 papers in various national and international conferences, besides chairing the scientific sessions. He's done research in the field of medicinal plants and herbomineral formulations, quality control of herbomineral formulations. Welcome, sir, and welcome all the participants who are waiting for the class. Welcome, sir.
Namaste, everyone. Yasmin sarvam yatah sarvam yah sarvam sarvatascha yah yascha sarvamayo nityam tasmai sarvatmane namah. Good evening. Thank you everyone for joining me today. At the outset, let me extend my heartfelt gratitude to all of you, all the members of AMAI, my dear student Dr. Jitesh, for giving me an opportunity here to interact with this august audience. So without much delay, let us start today's deliberation. The title that was given to me is Application of Rasaushadhis in Rheumatology and Autoimmune Disorders. Probably, considering the time frame, I will be concentrating on application of Rasaushadhis in rheumatology only, because autoimmune disorders is such an umbrella under which wide variety of conditions are incorporated, having their own pathophysiology and their own lines of management, similarly their own set of formulations to be considered and discussed, which will be too large. So I'm sorry that I will be mostly focusing on application of Rasaushadhis in rheumatology. When we talk about rheumatology, however, it's not only the autoimmune condition like rheumatoid arthritis or rheumatic fever or systemic lupus erythematosus. It can include many other inflammatory and non-inflammatory conditions related to musculoskeletal system. So that makes the presentation itself a large one. So with this note, let us begin today's presentation. I'm not going for the details of rheumatology. All you learned scholars, practitioners of Ayurveda know this very well. And also I'm not discussing on vis-a-vis correlation of rheumatoid arthritis, gouty arthritis, SLE with so many conditions like Amavata, Vatarakta, Prushtaka Shitra, Sandhigata Vata and so on. I will be focusing only on set of Rasaushadhis that we can use in managing various conditions that can be considered under rheumatology. However, as a customary, so let us have a couple of slides on rheumatology and then we will proceed. In all these conditions, Vata plays an important role. However, in pathogenesis of any disorders for that matter, Vayu is extremely important. So let us go to Pranadeva in the beginning itself. Om Sarva Pranaya Vidmahe Yashti Hastaya Dhimahi Tanno Vayu Prachodaya. Now let us start with the customary slide. What is rheumatology? So rheumatology is a subspecialty in internal medicine and pediatrics that deals with the joints, soft tissues, autoimmune diseases, and heritable connective tissue disorders. It is a medical science devoted to the rheumatic diseases and musculoskeletal disorders. Probably we can consider rheumatology as the study of autoimmune diseases and also study of connective tissue disease. It can be inflammatory or non-inflammatory type of rheumatology. Under inflammatory conditions, you will observe erythema, warmth, pain, swelling, prolonged stiffness, and systemic symptoms with laboratory abnormalities like raised ESR level, positive and increased CRP, RA factor, anti-CCP, and so on. Under non-inflammatory conditions, it may be mechanical pain, worse with activity, and improves with rest, stiffness after brief period of rest, not prolonged, and typically absence of systemic signs. So this is what we observe in inflammatory and non-inflammatory types. When you have to differentially diagnose different joint patterns, it may be monoarticular where single joint is involved, as in the case of trauma, hemarthrosis, spondyloarthropathy, or septic arthritis, crystal-induced arthritis, which can fall into all the three categories. Or it may be oligoarticular, where only a few joints are involved, always more than one. It may be spondyloarthropathy, or crystal-induced arthritis, or infection disease, or it may be polyarticular, like rheumatoid arthritis, systemic lupus erythematosus, again crystal-induced or infectious type of joint disorders. In our clinical practice, we usually encounter the conditions like osteoarthritis, rheumatoid arthritis, seronegative spondyloarthropathy, crystal-induced arthritis, systemic lupus erythematosus, vasculitis, and other important rheumatological conditions like scleroderma or inflammatory myopathy also. If I have to talk about the other part, that is the autoimmune diseases, as all of you know, these are the diseases that arise from an overactive immune response of the body against the substances and tissues that are normally present in the body. Here, the immune system mistakes some part of the body as a pathogen and it attacks it. This may be restricted to certain organs, or it may involve a particular tissue in different places. So these autoimmune diseases are a set of disorders in which tissue injury is caused by either humoral, that is autoantibodies, or cell-mediated immune response by autoreactive T cells to self-antigens. So normally, we know that the immune system does not attack the self. However, there is a large group of autoimmune diseases in which the immune system does attack self cells. So the attack can be directed either against a very specific tissue, or it may be on a large number of tissues also. So once started, autoimmune diseases are hard to stop. That is why they really pose a challenge for clinicians. So in modern system of medicine, they do not have an apparent answer for this except for immunosuppressants and some disease modifying agents, and nowadays maybe a few interferons. To quote examples, autoimmune diseases may be rheumatoid arthritis or SLE, systemic lupus erythematosus, or inflammatory bowel disease like ulcerative colitis, Crohn's disease, or multiple sclerosis, type 1 diabetes mellitus, GB syndrome or Guillain-Barré syndrome, psoriasis, Graves' disease, Hashimoto's thyroiditis, both hyper and hypothyroidic conditions, myasthenia gravis, vasculitis, chronic inflammatory demyelinating polyneuropathy, and so on. The list grows, and hence naturally it becomes almost impractical for me to discuss on the management of all these conditions in today's class. So I'm focusing only on Rasaushadhi in rheumatology, and sorry for that. In all my presentations on application of Rasaushadhi in clinical practice on various conditions, I usually start with these couple of customary slides, which, however, is repetition to all of you, but I feel that it is essential for us to boost ourselves regarding the importance and efficacy of Rasa Chikitsa. Rasa Chudamani says, Swalpa himatra vipula gunascha sadyohita deepana pachanancha. Small is the dose, high is the potency, and quickly access deepana and pachana. I think this is the most important thing that we will have to appreciate. Shighra deepana pachana is the important pharmacological property of most of the Rasaushadhis. We have seen that maybe because of the particle size or because of other catalytic property or targeted drug delivery like properties, these Rasaushadhis have quick absorption, quick assimilation, quick distribution, so naturally very high bioavailability. So whatever the herbal drug that is associated or added to it also will be showing quicker and better efficacy because of the contact with these bioenhancer Rasaushadhis. Hence, Deepana Pachana are essential important contributions of Rasaushadhis. And the most popular reference which we speak since our second BAMS level, Alpamatropayogitvad aruchera prasangataha, Kshiptam arogyadayitvad oshadhebhyo adhikorasaha. Small is the dose, no problem with palatability, quick action, high potency. And apart from this, we also have a pharmaceutical contribution of long shelf life that makes Rasaushadhi as superior. Asadhyeshu api datavyaha rasotah shreshta uchyate. That is another important attribute to Rasaushadhi. Even in asadhya or pratyakshaya condition, Rasaushadhi can be tried. It is advised that in asadhya condition you are not supposed to treat the patient. It may be because of fear that you may be blamed as patient is going to lose the battle imminently. But however, it is our responsibility to see that patient gets at least some relief, better quality of life, or improved lifespan, and it is Rasaushadhi that comes to our rescue in this condition. Formulations like Kupivapurasayana, certain Bhasma, certain Kottali are definitely useful in this regard. Hence, Asadhyeshu api datavyaha raso atah shreshta uchyate. What is the saukarya or the benefit or usefulness of Rasaushadhi? Na doshanam, na roganam, na pumsancha parikshanam, na deshasya na kalasya karyam rasa chikitsate. So let me repeat. A physician should not misunderstand this statement It doesn't mean that you are not supposed to, or you need not examine dosha, dushya, etc., or various factors related to the diseases, like stage of the disease or prakriti of an individual or desha, kala, etc. But even if you have no opportunity to examine in detail with all these factors, you can use rasaushadhis. They will not harm. That is in emergency situations. When patient comes to your clinic and suddenly collapses in front of you, you do not have the time to check all these factors. You will have to treat him immediately with some medicine. In such situation, it is the rasaushadhi which you can use without second thought. Further, it is said, Sarva Shastrartha Tattvajno na janati rasam yada sarvam tasya upahasaya dharmahino yatha buddha. Even if a physician has knowledge of multiple scientific disciplines, but he doesn't know about rasa, he doesn't know how to use rasa, everyone will mock at him. So one should definitely have adequate knowledge about the safety, about the efficacy, and about the clinical application of rasa. Before using these rasaushadhis, it is essential for us to keep in our mind certain important factors related to rasaushadhis. Samshodhya vidhina dhatu upadhatun vishanyapi yojayet karmani prajno dosha sanjayate anyatha. Bhaishajya Ratnavali has clearly mentioned in Jwaradhikari. When you talk about rasaushadhi, even though rasa literally may mean parada, rasa also means a potent drug, a potent substance. It can be any metal and mineral, maharasa, uparasa, sadharana rasa, sudhavargya dravya, or vishopavisha. A formulation containing only visha, without metals, minerals, mercury, also can be called as rasaushadhi. So when this is the situation, first and foremost thing that we must remember is samshodhya vidhina dhatu upadhatun vishanyapi. So you will have to primarily undertake the process of shodhana for these raw materials. If you use without shodhana, dosha sanjayate, it can cause several toxic effects, adverse drug reactions, deleterious effect on patients. Our ancestors had very clear knowledge about this. They knew about the safety and efficacy of rasaushadhis. They have stressed that a standard operative procedure has to be followed, because always a doctor or a consumer, both, are concerned about three things: quality, safety, and efficacy. Whether this drug or a substance that I am using or I am prescribing is of optimum quality, or is it safe for my patient or for me? Is it efficacious for the purpose that I am using for this? If quality is assured, most probably other two things, safety and efficacy, are also taken care of. However, only quality assurance is not enough. Being a physician, it is essential for you to understand the appropriate dose, appropriate anupana, appropriate time of administration, stage of the disease, type of the patient, duration of treatment, to assure maximum therapeutic benefit and minimum or no adverse effect. Because personalized medicine is the beauty of Ayurveda. First point starts with the shodhana itself. Rasa Shastra texts say, if ashodhita dravya is used, if asamyak marita dravya is used, what are the adverse effects that can occur and how you can counteract them? Another important factor in rasaushadhi is anupana, which we should never forget. Anupanai rasayojya deshakala anusaribihi. Anupana is not just important for therapeutic benefit. It also has got other important dimensions. An anupana can act as a bioenhancer. An Anupana can act as a vehicle so that you can ensure targeted drug delivery. A single drug, a bhasma, can be used in multiple conditions. So minimum medicines, maximum therapeutic application is what we have to follow, which is possible by selecting appropriate Sahapana and Anupana. So you will have to read the text like Rasatanangini, where you will find therapeutic applications, or Amayika Prayoga, where a single drug is indicated in multiple conditions with suitable Anupana. An Anupana decides the target organ or target system or target srotas and the target disease. Apart from this, Anupana also has got a safety effect, which I quote in all my lectures. That is the example of Rasamanikya. If you give Rasamanikya with Ghrita and Madhu as Anupana, as it is established by safety trials, in chronic and subchronic toxicity studies, it is seen that when Rasamanikya is given with Madhu and Ghrita, it doesn't cause any adverse effect, even in histopathology study or biochemical parameters or the hematological parameters, including gross behavioral pattern. Whereas when it was given with some other Anupana like Jala, in chronic toxicity study, it had shown that it causes fatty infiltration of the liver, a few necrotic damage in uterus. That is why cytoprotective effect also can be seen with Anupana. A suitable Anupana has to be followed in the case of Rasaushadhi. And most of the Rasaushadhis are to be administered in powder form. Totally, you know that it is ground and administered. Kuppa Kurasana also has to be powdered and administered. Parpati also has to be powdered and administered. Bhasma, Pishti are already in powder form. Many of Khalivya Rasayana, Lauha, Mandura Kalpa are also basically in powder form. But sometimes there may be references like Vatim Kritva, Kunja Matram, Vatim Kritva, Vatim Charet, like that. It may be for dose fixation or to see that dose variation doesn't occur. Even in such situation, you can prepare the pills, and those pills you can powder, mix with appropriate Sahapana and Anupana and administer to the patient for the best quick result. So Desha Kala Anusaribihi plan Anupana. If that is not possible, Doshagnaihi, you know very well that Snigdhosham Marute Shastam, Pitte Madhurashitaram, Kafenupanam Rukshoshnam. You can select Anupana of specific qualities depending upon the major doshas that are involved. You can follow that. Or Madhu. Madhu is the universal Anupana for Aushadha. Just like Jala is the universal Anupana for Ahara, Madhu is the universal Anupana for Aushadha because it is Yogavahi and it blends with almost all the medicines. It ensures quick absorption, assimilation and effect. If nothing is possible, nothing is not available on the spot, Kevalena Jalenava, even in that condition, Rasaushadhi shows some considerable therapeutic effect. So with this background, let us talk about Rasaushadhi in rheumatology. When I have to describe Rasaushadhi in rheumatology, it will be easy for me to categorize Rasaushadhis and take examples under each category. We have Rasayukta Guggul Kalpa, which I have separately taken, even though they are not actual Rasaushadhis under classification of Murchana. All of us know very well that Guggulu is the most important drug in the management of rheumatological conditions. Probably Commiphora mucul or Commiphora vitae and Oleogum resin was the first herbal drug to be evaluated for anti-arthritic activity in rheumatoid arthritis models in 1950s and 60s by Dr. Satyavati. And being practitioners, you know how extensively Guggulu Kalpas are used. I'm not going for all those detailed Guggulu Kalpa here. I'm selecting a few handful of Guggulu Kalpas where some mineral drugs are incorporated. Then based on the types of murchana of Bharata, Kalviya Rasayana, Parpati Rasayana, Kotali Rasayana, and Kupi Pakwa Rasayana. Then Lauha Kalpas, which can include Mandura also. Then Bhasma and Pishti. So under these headings, we will look at the examples of Rasaushati that can be used in various rheumatological conditions. I will be probably focusing on three important conditions that are encountered in clinical practice. They are Amavata, Vatarakta, and Sandhigatavata. Whatever is your risk correlation. So let us begin with Rasaushati useful in Amavata. We will start with Rasayukta Gugulu Kalpas. First example is Mahayogaraja Gugulu. You do find the reference of Mahayogaraja Gugulu in texts like Sharangadhara Samhita and also Vaishakya Ratnavali with some minor differences. If you see the reference of AFI volume 1, you will find the reference of Sharangadhara Samhita that is quoted here, which is most popularly used in clinical practice. Vangam Raupyancha Nagancha Lohasaras Tatha Prakam Rasa Sinduram. These are the important mineral drugs that are incorporated in the formulation of Yogaraja Gugulu to make it Mahayogaraja Gugulu. It is used in a dose of half to 1 gram along with Rasnadikwata or Yathavyati Anupana. There are sets of Anupana mentioned for Yogaraja Gugulu and Mahayogaraja Gugulu. You must be knowing them. Rasnadikwatha Sahito Vividam Hanti Marutam, Tankolya Dishitat Piktam, Kafam Aragwadhadina. All this list of Anupanas, at least 12 various Anupana are mentioned. So here, Rasnadikwatha can be used, or according to your clinical experience, you can modify Anupana also. Apart from Amavata, it's also indicated in Sandhigatavata, Kroshtu Shirsha, Kushtha, in Vataja, Pittaja, and Kafajaroga also. In Pittajaroga, Tankolya Dishitat, in Kafarajaroga, Aragwadhadin, Darvi Kwathena Mehamscha, Chinna Kwathena Vatasram, Shotam Shulam Kanashritat. So this is the description available in the text. Simhanada Gugulu and Vatari Gugulu are the two formulations which are described in various texts like Bhavaprakasha, Vaishakya Ratnavali, etc. Ingredients are same, but ratio is a bit different. I am mentioning here the formulations that are quoted in Vaishakya Ratnavali. And these formulations are popular in clinical practice and also are taken in Ayurveda Formulary of India. Simhanada Gugulu contains Triphala, Gandhaka, Erandatela, Gugulu, all ingredients in equal quantity. Here, according to AFI, Triphala, Shuddha Gandhaka are finely powdered, added with Erandatela and Shuddha Gugulu, pounded well to prepare a homogeneous mass from which pills are prepared and used for clinical application. The dose mentioned is around 1 shana or 3 grams. That is the practical dose. Amavata is the primary indication, also Vatarakta. Apart from this, Kanja, Pandu, Kushtha are the indications that are mentioned in the text. Vatari Gugulu is a preparation that also contains Triphala, Gandhaka, Erandathaila and Gugulu. But here, first Triphala Kashaya is prepared. Triphala are taken in 1 pala each quantity, added with 4 times of water, boil to reduce to 1/4 and filter. To this Kashaya, you have to add Shuddha Gandhaka and dissolve, then add Shuddha Gugulu and dissolve, incorporate Erandathaila, mix it thoroughly, and then prepare the pills and use it in clinical practice. 3 grams is the dose. Warm water is the Anupana that is indicated. Sorry for the technical glitch. I am back. Another formulation which is found to be clinically effective is Panchamrita Loha Guggulu, mentioned in Bhaishajya Ratnavali. This contains Kajjali, Raukya Bhasma, Abraka Bhasma, Makshika Bhasma, Lauha Bhasma, apart from Shuddha Guggulu. This formulation we have found to be useful and effective in management of muscular rheumatism and also in those individuals who are suffering with fibromyalgia. Cases of fibromyalgia nowadays are very common and increasing day by day. 2.5 to 3 grams is the dose that is indicated, but in market probably you will be getting a 250 milligram tablet. At least 1.5 gram per day has to be used for required therapeutic effect. Lukewarm milk can be used as Anupana. So in the reference, you will find the indications in Amavata, Snayu Roga, Vata Roga, and even with Mastika Roga. Shiva Guggulu, mentioned in Rasendra Sara Sangraha, is indicated in Savibandha Amavata, Amavata associated with constipation. This is also a Gandhaka containing Guggulu Kalpa. So these are a few of the Guggulu Kalpas that do contain minerals in them. That is why I have taken it. Next, we will see about the Kalviya Rasayana that are useful in Amavata. To start with Rasaraja Rasa. There is a huge list, only a few of them I will highlight. Rasaraja Rasa, probably some of you might have already used in your clinical practice. Mostly it is being used in Vata Vyadhi, in the conditions like Pakshagata, Ardita, it is being used. However, it has got a specific indication in Amavata also. In Nirama conditions, this is more effective. It is a Rasa Sindhura containing yoga, having Abhraka Sattva Bhasma as a component. It is good Rasayana also. 1 to 2 rati or 125 to 250 milligram with honey, milk, or Sharkarodaka are the Anupa. Even in Sandhigata Vata, you can make use of Rasaraja Rasa, which is available in the market. Brihatvata Chintamani is another popular preparation in clinical practice, which is again used commonly in the case of Vata Vyadhi. It is more useful in chronic Vataja disorders. In Ardita, it is used. In chronic type of Pakshaghata, it is used. It is also used as a Rasayana. Even in chronic Sandhigata Vata, it is used. Its specific indication in Amavata is in Jirna Amavata conditions. It is found to be really effective. It is a Vrisha preparation also. Only the problem is it is a Swarnakalpa, a bit expensive. In market, you will also find Brihatvata Chintamani plain, that is without Swarna Bhasma, which is not so much therapeutically effective. 1 to 3 rati is the dose with Uduchi Swarasa, Ajakshira, Brahmi Rasa, Madhu, or Yathavyachi Anupana. You will have to plan the Anupana according to the targeted indication. An important rasaushadhi that I have to highlight in Amavata management is Vata Vidhvamsana Rasa, especially in rheumatoid arthritis. When the condition is very painful, in acute exacerbation of the condition, pain, swelling, redness like inflammatory changes are observed, Vata Vidhvamsana or Mahavata Vidhvamsana Rasa is found to be extremely useful, which I use in my clinical practice very frequently. Dose advisory is 2 to 3 rati. In market, you may be getting 1 to 2 rati tablet, but at least 2 rati, 250 milligram is absolutely essential. I do not advise to give this for a prolonged period, maybe for a short period, maybe 2 to 4 weeks to maximum, to see that the exacerbated condition comes into control. It is also Abrakasattva Basma containing preparation. We do find different Vata Vidhvamsana Rasa references. You will have to carefully observe. There is a Vata Vidhvamsana that contains Jayapala also. So you should know that it is Jayapala Yoga. Otherwise, patient may complain of diarrhea. You should give the caution to the patient. 2 to 3 rati is the classical dose. Ideally, it is to be powdered, mixed with honey and administered. In other Shula Yukta Vata Vyadhi, like Gridrasi also it is used. In Udara Shula also it is mentioned. In Manya Stambha or in lockjaw like conditions, it is very effective. Amavatari Vatika and Amavatari Rasa are two formulations mentioned specifically in Amavata in Vaishakya Ratnavali. Amavatari Vatika is given in Amavata, then Gulma, Udara like conditions also. Even in Arbuda, certain types of intra-abdominal tumors, it is evaluated. Triphala Jala is the Anupana. 750 milligram to 1.5 gram is the dosage. Amavatari Rasa is available in the market, whereas Amavatari Vatika probably is not available as per my knowledge. Amavatari Rasa taken from Vaishakya Ratnavali is also quoted in AF5, where ratio is a bit wrongly quoted in AF5. You follow the reference mentioned in Vaishakya Ratnavali. Here Kajjali, Triphala, Shuddha Chitraka, Shuddha Guggulu, Eranda Taila are the important ingredients. Dose mentioned is 1 karsha, even though in practice we are not giving it in a dose of 1 karsha. Probably you may be giving in a dose of 1 shana or 3 grams in divided dose. Ushna Jala is the Anupana. Person is advised to avoid Mudga and Kshira in the diet. It is mentioned that this formulation is useful in Ugra Amavata, in severe exacerbated conditions of Amavata. This is the reference. Raso Gandho Varavahnihi Guggulhu Kramavardhitaha Etaderandatoyena Stakshna Prapeshayet Rubutairena Shadgunjo Hanti Ushna Jalapayadam Amavatam Ati Ogram Dugdha Mudga Divarjaye. So here Shuddha Parada 1 part, Shuddha Gandhaka 2 parts. You have to prepare Viguda Gandhaka Kajjali, then Triphala together 3 parts, Shuddha Chitraka 4 parts, Shuddha Guggulu 5 parts, Krama Vardhita. Eranda Taila is the base in which so these are amalgamated and used. Amavateshwara Rasa and Vata Gajendra Simha are 2 formulations mentioned in Amavata Chikitsa Adhikara. Probably both are not available in the market. Worth exploring. I'm not going for much details here. Ama Pramathini Vatika is another formulation mentioned, which is a Kshara containing formulation worth trying. This Ama Pramathini Vatika contains Suryakshara, Arkamula, Shuddha Gandhaka, Lauha Basma, Abraka Basma, and a Bhavana of Aragvapatra Rasa is mentioned. 750 milligram or about 1 masha is the dose Trivrit Kashaya is the Anupana with a specific indication of Amavata. In Rasatantra Sara Siddha Prayoga Sangraha, a slight different dose is mentioned. Here author mentions 2 to 4 rati or 250 milligram to 500 milligram as the dose. He has given 2 different anupanas which is very unique according to the Aushadha Sevanakala. He says that morning you have to administer Amapramatni with Trivrit Kashaya. Evening you have to administer this with Ardhaka Swarasa and Mathu. And he says in Tivra Vedana Yukta Amavata it is useful. At the same time, even in Jirna Amavata also it is effective. So this is a formulation which is worth trying in clinical practice. Then we have Amavata Drivajra Rasa and Amrita Manjari Rasa. Both these formulations have other indications like Prameha in the case of Amavata Dri, and in Amrita Manjari, Agnimandya, Ajirna, Kasashwasa as other indications. Amavata Drivajra, anyway, it is not practical for us to use it because it is Ahifena Yukta Yoga and also Bhanga Yukta Yoga. Unfortunately, we are not allowed to prepare them. You may be knowing that Bhanga is allowed nowadays. Hemp Street, like certain companies, are preparing Bhanga containing formulations like Madananda Modaka, etc. And they have marketed it. And I hope that there are some issues in Kerala related to the use of Bhanga containing formulations. So we hope that in coming days we do get the permission to use Ahifena and Bhanga exclusively once again in Ayurveda practice. Till that, Amavata Drivajra is out of the list. Amrita Manjari is useful in Sama condition of Amavata. Chaturmukha Rasa, you do find several references of Chaturmukha Rasa. It is mentioned in Juradhikara, mentioned in Atisaradhikara, mentioned in Rajayakshamadhikara, mentioned in Pramehadhikara, mentioned in Vatavyadhikara, and so on. Chaturmukha Rasa mentioned in Vatavyadhikara as an additional indication of Amavata also. So this is a Swarnabhasma Yukta Yoga. Half to 1 rati is the dose. Triphala Churna and Mathu is the Anupana. Jvara Murari Rasa is indicated in Amavata in a dose of 1 rati. And many Jvaraghna Rasaushadis, to quote the most important, Mrityunjaya Rasa. Then even Hinguleshwara Rasa. Those Vatsanabha containing, Hingula containing Jvaraghna preparations are indicated in Amavata also. Because to a great extent, Samprapti of Amavata and Jvara have got lots of similarities. In many of such formulations, we do find Amavata as an indication, or even when there is no indication as Amavata, these Jvaraghna preparations can also be used by clinical practitioners, and they are using it. However, I have not taken those examples wherein Gunapatha Amavata is not mentioned. Mruta Sanjeevini Rasa and Chudamani Rasa are 2 more formulations mentioned in Amavata. Shleshma Shailendra Rasa, which is also called as Rasendra Gutika, is indicated in Amavata and also in Kafajjora and Shiroro. 1 rati to 4 rati is the dose. It is a Tamrabhasma containing formulation. Ardraka Rasa or Ushnatoya is the Anupana. In Kafajjora, Ardraka Rasa is the Anupana indicated. Lakshmi Vilasa Rasa, there are several formulations. 7 of them are important. Lakshmi Vilasa Rasa may be there in Vajikaranadhikara, then in Shirashwaradhikara, then in Pratishayadhikara, then in Rajayakshamadhikara, then in Jvaradhikara, and so on. The formulation which is mentioned in Dhatugata Jvara and Shiroroga is having an indication in Amavata specifically. This is a Krishna Bhrakabhasma containing formulation, having Dattura Bija and Vidhadar Bija as important ingredients. 3 rati or 375 milligram is the dose. Dugdha Dati and Kanjika are very unique Anupana that are mentioned. Mahabhravatika and Sri Nipati Vallabha are 2 formulations. Both Sri Nipati Vallabha Rasa and Mahabhra do contain Abhraka as an important ingredient, Both are having primary indications as Jvara. Sri Ramabana Rasa, Ajirna Kalanala Rasa, and Vishoddeepika Rasa. These are indicated in Agnimandya, Ajirna, Atisara like conditions, and indicated definitely in all Sama condition of Amavata. Very effective. Out of these, important formulation that I need to mention is Sri Ramabana Rasa, which is to be given in a dose of 750 milligram with Jeera Kachurna and Mathu. Couple of sentences on Ramabana Rasa I will discuss again. Veerabhadrabhra, then Chandra Suryatmaka Rasa are two more formulations mentioned in Vaishakya Ratnavali. Veerabhadrabhra contains Sahasraputi Abhrakavasma, Chitraka Rasa and Adraka Rasa as Bhavana Dravya. Turati is the dose. It is to be given wrapped in Tambula Patra or can be given with Ardraka piece or Ardraka Swarasa. In Agnimandya associated Amavata, it is effective. Chandra Suryatmaka Rasa has other indications like Pandu and Raktapitta also. Manda or Guduchi Rasa or Mudgayusha are the Anupada. It is to be given in a specific course, that is around 500 milligram twice a day, to be given for 2 weeks. This is a Shankabhasma containing formulation. Shulavajrini and Vidyadharabhra Brihat are two more formulations mentioned. Shulavajrini is an effective formulation which we evaluated in our institute between 2001 and 2004. So Dr. Sudhindra Adiga worked on this Shulavajrini Rasa. He carried out a pharmaceutical study, he standardized the formulation, he analyzed it, he used it clinically in Amavata condition, and he had found that it is clinically extremely useful in treating Amavata conditions. It is to be given in a dose of 750 milligram with Sheetalaja. It is said that in Ashtavida Shula, Pliha and Gulma also it can be used. In Amavata, where pain is the predominant presenting symptom, Shulavajrini is worth trying formulation. We have Shankadravata Rasa, which is a distilled formulation, as you know very well. It is a very good Depaka Pachaka. 5 drops of it can be used with warm water in Amavata and also in Yakrut Piharoga and Udara like conditions. It is not a specific drug in Amavata. Bhairava Rasa is another formulation which is indicated in Upadamsha also. Probably it can be used in psoriatic arthritis like conditions. You have to start it in a dose of 3 vati per day for 3 days, followed by 1 vati per day for 11 days. Here, 1 vati is of a size of about 2 grams. So this is how Bhairava Rasa has to be used. Very high dose is mentioned, and a total duration of treatment is around 14 days in this condition. There is another very interesting formulation here, that is Nashta Pushpantaka Rasa. Probably some of you might have used Nashta Pushpantaka Rasa in the conditions like oligomenorrhea or dysmenorrhea or amenorrhea like conditions. It is having an indication definitely in Rajakshaya, Vandhyatva also, but it has got very unique indication in Amavata. 1 to 2 rati is the dose. Ushnajala is the Anupana. It is a Rajata Bhasma containing formulation. Ramabana Rasa, as I mentioned, is worth quoting here. In Rasendra Sara Sangraha, after mentioning various formulations under Amavata Chikitsa, he says, Ramabano Rasodeyo Yogavahi Rasendrakaha, Amavate Vidhiyante Sanupanaha Prayatna. Various other Rasaushadis, like Ramabana to be specific, can be used in Amavata even though they are not mentioned in Amavata, mainly because of their Yogavahi property. Now let us go to the third set of formulations, that is Parpati Rasayana, that are useful in Amavata. We know that Most of these Sagandha properties are indicated in the conditions like Grahani, where Agni is affected. In Amavata also, Agni is the main culprit. When you see these formulations, we will find that Amavata is one of the indications. So I have not mentioned the properties where Amavata is not mentioned in Gunapatra. However, in Rasavarpute, you know that Grihani Gajamardana Dakshatara Kshayakasa Jalodara Gulmahara Disaramati Pramadaha. Like that, you will find list of indications. So one among them is Amavata. Lauha Parpati, apart from Grihani and Pandu, has an indication of Amavata. Panchamrita Parpati is the best drug in Sangrahini. It is also having an indication in Amavata. However, these Parpati preparations are very rarely used in Amavata, but they may be used in Amavata associated with other malabsorption like conditions, especially in chronic situations. Potali formulations are also not so popularly used in Amavata. However, two Pottalis are worth quoting, Rasagarbha Pottali and Hemagarbha Pottali. Both are available in the market nowadays. Rasagarbha Pottali is having an indication in Kafaja Jwara. 1 Ratti is the dose to be given with Mathu. Hemagarbha Pottali, there are many references. You can select the formulation that contains Tamra Bhasma and Swarna Bhasma or Swarna Tantu with Kajjali and Kumari Rasa as Bhavana Dravya. Half Ratti is the dose to be given with Mathu. This formulation is very effective in Kasa Shwasa and in acute management of Hridroga, in ischemic heart disease. There are many evidences for this. It also improves the oxygen saturation level. However, it also can be used in Amavata in clinical practice. Under Kupipakva Rasayana, we have Malla Sindhura, Makaradhwaja, Siddha Makaradhwaja, Samira Pannaga has a few of the formulations that can be considered. Out of these, Samira Pannaga is the most effective Kupipakva Rasayana in Amavata, which is being used in clinical practice. There are many proprietary formulations containing Samira Pannaga available in the market. Even Siddha Makaradhwaja is also evaluated in Amavata. Malla Sindhura is very potent. At the same time, you have to be careful about its dose and duration. It is to be ideally given in a small dose of about half rati, say 60 to 62.5 milligram with Ardhaka Swarasa and honey, ideally for 2 weeks duration. Samira Pannaga is the most important drug that can be tried in Amavata management in a dose of 60 to 120 milligram or 125 milligram along with betel leaf juice or ginger juice and a few drops of honey. In Amavata and in Vata Vyadhi and Shwasakasa also it can be used. Samira indicates Vata. It is just like Pannaga or serpent to bind Samira. Siddha Makaradhwaja itself may not be having a direct impact on Amavata. It is a bioenhancer. Along with other formulations, it is found to be very effective. However, Siddha Makaradhwaja alone and along with Ashwagandha were tried in Amavata and found to be very useful. It is better to give 60 to 120 milligram of Siddha Makaradhwaja with Ashwagandha Churna and honey or butter or Tulasi Swarasa and Ardhaka Swarasa. Tulasi Swarasa and Ardhaka Swarasa are more useful in the conditions like Shwasa and Hrutshula. For Hrutshula, Ardhaka Swarasa, for Shwasa, Tulasi Swarasa. For Amavata, probably Ashwagandha Churna and Madhu will be better option. And for Vrisha purpose and Rasayana purpose, Navanita can be better option. Under Lauha Kalpa, we have a long list. Except Vidangadi Lauha, others are not available commonly in market. Due to the paucity of time, I am not going for the details. Just the names I will mention: Trifaladi Lauham, Vidangadi Lauham, then Panchanana Rasa Lauham, Vruddhadarvyadi Lauham, then Maham Mrityunjaya Lauha. We have Chatussama Lauha, and a very effective drug Amrudankura Lauha, Agnimukha Lauha, Ashtadashanga Lauha, and Sarvatobhadra Lauha. Under Bhasma, we have Swarna Bhasma, Abhraka Bhasma, Pravala Bhasma, Godanti Bhasma, Kukutandatva Bhasma, and so on. Swarna Bhasma is a disease modifying agent in chronic Amavata rheumatoid arthritis. It can be effectively used. Abhraka Bhasma is Vatagna, again in Jirnama Vata and Sandigata Vata, even in Vatarakta it can be used. Pravala Bhasma, Godanti Bhasma, Kukutandatak Bhasma, they are useful in all such rheumatological conditions wherever osteoporosis is observed. In osteoarthritis they are useful. Even in the erosion of ligaments and cartilages, Pravala Bhasma, Godanti Bhasma and Kukutandatak Bhasma are found to be effective. Under Pishti, again Pravala Pishti, Jahar Mohra Pishti and Akika Pishti can be used in clinical practice in Amavata and Sandigata Vata like conditions. So we have Abraka Bhasma here. Ensure the quality before using it, because many of Abraka Bhasma samples do not pass even Varitaratva. Pravala Bhasma and Pravala Pishti you can see. We have Godanti Bhasma. Here Kukutandatak Bhasma, Samanya and Vishesha Kukutandatak Bhasma containing Hingula, Akika Pishti, Jahar Mohara Pishti. Then a few formulations specified in Chikitsa Pradipa I would like to mention. In most of my presentations I mention these formulations given by Bhaskar Vishnu Gokhaleji, who is responsible for a revolutionary change in clinical application of Rasaushadis, where he effectively combined various Kottalis, Kajjali, Parpati with herbal drugs to make them more bioavailable. He has explained the formulations in Amavata according to various stages. In Avavastha, Akvavastha and in Jirnavastha he has mentioned the formulations. In Amavastha, Simhanada Vata Vidhvamsana Mishranam is the unique combination mentioned by him. I will tell you what are they. Simhanada Vata Vidhvamsana Mishranam is to be given in a dose of 500 mg to 1 gram. Antara Bhakta, Trivara is difficult in Antara Bhakta at least 2 times in between the meals. That is, after one meal is digested, medicine is given. After medicine is digested, second meal is given. Ushnodaka or Rasnadi Saptaka Kashaya is the Anupada. In Pakvavastha, Samira Yogarajaha, Simhanada Gugulu and Bhallata Kavaleha are the 3 formulations mentioned. Samira Yogarajaha 4 to 8 Rati with Rasna Saptakatvatha or Kshira. Simhanada Gugulu again 4 to 8 Rati with Maharasna Rikvatha. Then Bhallata Kavaleha half to 1 Karsha. It has to be given Apanakara just after food. So may not be suitable to give it in Antarabhakta period because it can cause irritation. It is to be given with Kshira always. Then in Jirnavastha, there are 3 unique formulations. I will mention what are they. Swarna Vasanta Mishranam to be given in a dose of 750 mg to 1.5 gram. Again Antarabhaktam with Kshira. Swarna Yogarajaha 2 to 4 Rati Antarabhaktam with Maharasnari Kashaya. Gudabhallata Harita Kivati half to 1 kash, 6 gram to 12 grams, Swapna Kalam at bed, Ekavaram once a day with milk. Now let us see what these formulations are. Simhanada Vata Vidhvamsana Mishranam is a unique combination of Simhanada Gugulu and Vata Vidhvamsana in a ratio of 4:1. This mixture can be used in a dose of around 1 gram to 1.2 gram in clinical practice. Samira Yogarajaha is a combination of 3 formulations: Samira Pannagarasa, Yogaraja Gugulu and Vata Vidhvamsana. 1 part of Samira Pannaga, 4 parts of Vata Vidhvamsana and 8 parts of Yogaraja Gugulu. This mixture can be given in a dose of around 750 mg to a maximum dose of around 1.25 grams. Swarna Vasanta Mishranam, which is indicated in Jirna Amavata, contains Swarna Vasanta, that is Swarna Malini Vasanta 2 parts and 4 parts of Amapa Chakavati. This mixture is given in a dose of 1 to 2 masha, 750 mg to 1.5 grams. Swarna Yogarajaha is a combination of Swarna Bhasma and Mahayogaraja Guglu 1:8. Dose is 2 to 4 rati. Uda Bhallataka Haritakavati is a combination of jaggery, Bhallataka, Shodhita and Haritaki in equal quantity. Dose is 1 to 3 masha. Then some quick look on Rasaushati for Vatarakta. In Vaishajya Ratnavali, Vataraktantaka Rasa and Vishweshwara Rasa are mentioned. Vataraktantaka Rasa in a dose of 2 to 6 rati with a kashaya or churna made up of Nimba Patra, Nimba Pushpa, Nimba Twak combination and 1 karsha of Goghrita. In Vata Vyadhi also it is used. Vishweshwara Rasa, a Tutta Yoga, rarely used in clinical practice. Anupana used to be decided by physician. In Vatarakta, Jwara and Kushtha it is mentioned. Mahatalakeshwara Rasa and Sarveshwara Rasa are indicated in Vatarakta and Kushtha both conditions. Mahatalakeshwara Rasa is a Haratala containing formulation. So dose should be carefully determined. 30 to 60 milligram with honey and ghee. Sarva Kushtha, Vatarakta, Ashtavidha Shula and Shvitra are indications. Sarveshwara Rasa 250 milligram with Mathu. Then Bakuchi Churna, Devadaru Churna and Erandatai. In Vatarakta and in Sukti Mandala Kushta, including variant of leprosy, Sarveshwara Rasa is indicated. Mehamudgara and Yogendra Rasa. Mehamudgara is mentioned in Pramehadikara, also in Mutra Krichara Raktapitta and Vatarakta. Yogendra Rasa is a marketed formulation in Vatavyati. It's also indicated in Prameha. It is a Rasa Sindhura Swarna Basma containing formulation. It is to be given with Rifra Kashaya and Mathu. Dwadashaya Saha, Guduchadi Lauha are 2 Lauha preparations indicated in Vatarakta. Pittantaka Lauha and Langalyadi Loham are 2 effective formulations in Vatarakta. Pittantaka Lauha is not available in the market. 2 to 6 rati with Patola Patra Dhanya Pukvata, effective in other Pittaja Vikaras Yakrit Roga also. Langalyadiloham is an evaluated formulation. It is one of very few formulations of Langali mentioned for internal administration. It's also mentioned in Sarvanga Sputita Kushta. Mathu is the Anupana, dose is 3 rati. One important prayoga under Bhasma in Vatarakta is Haratala Bhasma. Haratala Bhasma is a very potent drug. However, it is toxic, but you have to give it in a controlled dose for a specified duration. Haratala Bhasma is a thesis work of Dr. Shashikumar Nichil sir, who evaluated extensively its antimicrobial and safety profile also. In our institute also, we worked on a comparative study of Tala Bhasma and also Rasamanikya. We carried out its experimental study also, antihistaminic profile and effect on mast cell degranulation also we have studied. Here in Vatarakta, a specific prayoga is mentioned. Haritalam palam shuddham tatha karsham vishasya. You have to take 1 pala of Shuddha Haritala and 1/4 of it, 1 karsha of Shuddha Vatsanapa. Shweta Ankotha Rasena iva dvayame katra khalayet. Grind them with Shweta Ankola Moola Rasa. Then in a pot, take Palasha Bhasma, 2 pala, and on that Haratala Golaka, Haratala Vatsanaba Golaka is placed. Tasyopari Apamarga Bhasma Dadyat Palatrayam. On that 3 pala of Apamarga Bhasma is added. Sthali Mukhe Sharavancha Dadyat Yatnena Lepayet. Close it with a Sharava and seal it. Lepayitva Tataha Chulyam Ahoratram Pachepsham. So this pot is placed on a chulika and heated for 24 hours at a controlled temperature, and after Swangashita open to get a Tala Bhasma like Karpura. This Haratala Bhasma is very effective in Vatarakta. This is the Shweta Ankotha Alingium salvifolium. Its root juice is used here as a Bhavana Dravya. In Vatarakta, 1 gunja is the dose with specific Anupana. Apart from Vatarakta, in various kinds of skin disorders, so challenging skin disorders, you can try this. In the conditions like Dadru Vispota, in Vicharchika Apachi, in Charmadala, Halimaka like conditions also we can make use of this Haratala Bhasma. There is another unique Bhasma Tamratalayo Talena Nihitam Tamram Rasagandaka Sayutam Bahuda Putitam Talam Vatarate Mahoshaka. Sorry. Here Kajjali is added with Shuddha Haratala and Tamra. Then Puta is given to get a unique Bhasma which is very useful in treating Vatra. Shilajatu Prayoga is mentioned in Vatrakta, where Shuddha Shilajatu alone is given along with Guduchi Kashaya. Chinnodbhava Kashayena Sevyam Shuddham Shilajatu. When it is most effective, Panchakarma Vishuddhena. When person is purified with the Panchakarma and then if it is administered Vatarakta Prashante, it is very